Good evening, Berkeley. Thank you for tuning in to my first video update on the City of Berkeley's response to COVID-19. And every Monday and Wednesday evening, I'll be posting a video update on the work the City of Berkeley is engaged in to address this state of emergency. These brief videos will provide a summary of the work of our Emergency Operations Center, as well as other relevant and critical information for Berkeley residents. In addition to these video updates, we'll be hosting weekly town hall meetings, including with relevant city staff on Fridays, starting this Friday, April 10th. And we will soon provide the exact time and ways that you can tune in and participate. So stay tuned. I want to provide an update on the current numbers of COVID-19 cases in the city of Berkeley. As of this morning, there are 31 lab-confirmed cases and 0 deaths attributed to COVID-19 in Berkeley. This number only reflects lab-confirmed cases, so it's important to remember that this does not reflect the total number of people in Berkeley that are infected with COVID-19, which you know is a much larger number. The data shows that there still is substantial community spread in our area, and many people with COVID-19 may have mild or no symptoms, but they can still spread the disease. So it's important that we still practice social distancing when you're outside, that you wear a facial covering, but that you stay at home as much as possible. I want to take this opportunity to thank all the frontline staff that are working so hard during this difficult time to help treat those people infected with COVID-19, as well as keep our broader community safe. And these include first responders and frontline medical staff, and these people are literally putting their lives on the line and deserve our deepest gratitude and support. We know that due to poor prior planning by the federal government, that our hospitals and our communities are under-resourced, particularly in terms of the number of ICU beds, ventilators, and adequate staffing to staff our hospitals. As we are working rapidly to prepare for what we know is going to be the peak of this pandemic, the coming days and weeks, it's important that we continue to prioritize the health and safety of these frontline staff. And so to that end, the city will be partnering with the City of Oakland to provide testing for first responders and other staff. We're also exploring propping up our own testing site here in the city of Berkeley for frontline staff as well as for community members to get access to COVID-19 testing. We encourage members of the public to please provide donations of masks and other personal protective equipment. And please go to the City of Berkeley's website, www.cityofberkeley.info/coronavirus, cityofberkeley.info/coronavirus to sign up and donate. These donations will be processed by our staff and provided to first responders and medical personnel. And lastly, I want to acknowledge and thank all the members of the Berkeley community that have been stepping up and during their free time donating personal protective equipment to frontline staff. And I want to specifically call attention to the work of Ayelet Waldman and restaurateur Jenny Schwartz, who helped launch East Bay Feed ER. They have raised over $200,000 in donations and are coordinating meals from our local restaurants to feed our personnel at our local emergency rooms and intensive care units. And they're not only supporting our small businesses who need our help during this difficult time, but they're also supporting our frontline medical staff. I'm really inspired by the creativity and compassion that people in our community are showing during this difficult time, and the care and concern they're showing not only to our frontline staff, but the neediest people in our community. And it's really in moments like this, moments of crisis and challenge, their community really shines, and their community has come together. I want to update you on the Berkeley Relief Fund. As you know, we launched the Berkeley Relief Fund last Monday, and thanks to the generosity of Berkeley residents and organizations, as of last week, we raised over $681,000 for the Berkeley Relief Fund. The largest donation coming from Bayer Pharmaceuticals, who donated $250,000. Thank you, Bayer. Thank you to the many large businesses and residents, thousands of whom have provided donations to the Berkeley Relief Fund. As you know, the city provided $3 million to initially launch this fund, and we have a goal of $3 million in private donations to help as many small businesses, arts nonprofits, and residential tenants that are affected by this pandemic. The money in this relief fund will be split 3 ways: supporting our small businesses, supporting arts nonprofits, and residential tenants who are facing eviction during this pandemic. So every dollar that you give will match the city's contribution. We'll be able to help as many people as possible make it through this crisis and keep our city diverse and vibrant and inclusive. So please give what you can to the Berkeley Relief Fund at berkeleyrelieffund.org. berkeleyrelieffund.org. The criteria for funding and to apply is on our city's website. Once again, that address is cityofberkeley.info/coronavirus. And the deadline for small businesses to apply for business continuity grants was actually today at 5 o'clock. And these grants will be available to nonprofits that aren't arts organizations, as well as businesses of 50 employees or less, who can demonstrate at least a 25% reduction in revenues due to COVID-19. Businesses are eligible for up to $10,000 in individual grants, and we will soon launch a second round of funding. So every dollar you give will help as many businesses as possible. So please give at berkeleyrelieffund.org. I want to provide an update on some of the efforts the city's been engaged in since the start of this emergency to provide shelter and necessary services for people experiencing homelessness. As you may know, the city recently cited 8 trailers to provide isolation and shelter for medically frail COVID-19 positive or presumed positive individuals at 1281 University Avenue. We're also using a city property at 1654 Fifth Street for isolation for homeless individuals, and we're looking at our recreation centers to provide shelter with adequate social distancing. We're concerned that many homeless people in our shelters are living too close to each other, and to ensure adequate social distancing, we're looking at propping up shelter sites to provide emergency shelter and services outside of our crowded shelters. The state's going to provide 10 additional FEMA trailers that we're going to locate on a city property to provide additional shelter and isolation for homeless people experiencing COVID-19. We're working with our state and county partners on leasing hotels and hotel rooms for homeless people that are symptomatic with COVID-19. And this is in addition to all the work that we're doing with lifelong medical care, providing medical outreach to people on the street, the outreach our city staff and homeless service providers are engaged in to connect with people living on the street and in homeless encampments, to make sure that they have access to basic sanitation and information about how to stay safe. We installed 22 hand washing stations throughout the city, and we're working on expanding access to more hand washing stations, portable restrooms, and shower trucks so we can provide portable mobile showers for homeless people to have access to basic sanitation. We're working with service providers to expand access to meals. We've requested additional tents from the state for additional isolation, and our work will continue to identify hotel rooms, hotels, shelter, and trailers for isolation and care for the neediest people in our community. I want to talk about one issue we got a lot of questions about, which is construction and what construction is allowed under the shelter-in-place order. The recent shelter-in-place order that was issued last week is more restrictive around what construction would be allowed in the city of Berkeley. And I want to remind everyone about what construction is permitted. Construction work is now only allowed for healthcare facilities directly related to COVID-19 response, shelters and temporary housing for the homeless, affordable housing projects, including mixed-use residential projects with at least 10% of the units on site reserved permanently affordable for households in our community. Projects that are providing critical services to vulnerable individuals, essential public works projects, and work that's needed on existing homes and structures to ensure safety and habitability. Non-essential construction projects must cease, and those sites must be secure. If you have questions or concerns about an active construction project, please email the Berkeley Planning Department at planning@cityofberkeley.info or call the Planning Department at 510-981-7410. And please provide the project address and a short description of the activity that you're concerned about. So construction is still allowed, but only in limited circumstances. And if you see construction that you're concerned about, please contact the Planning Department. We know that the governor last week extended the protections against price gouging. Sadly, we've seen during this pandemic individuals and businesses that have charged prices for essential goods and services beyond the rates that are reasonably allowed and are taking advantage of this crisis by price gouging. So the governor extended these protections for up to 5 months through September 2020. And if you have been a victim of price gouging or you have information about price gouging, you're encouraged to contact the Attorney General's office by calling 1-800-952-5225. I want to touch upon the recent changing guidance from not only the California Department of Public Health, but our Berkeley health officer. While I do that, I'm going to put on my facial covering. So our Berkeley Public Health Officer, Dr. Lisa Hernandez, has joined other health officers in the region in revising recommendations on the usage of face masks. We know that the CDC has said now that COVID-19 can be transmitted through just simply talking and breathing. So that's why it's so essential that when we leave our house, that we cover our nose and mouth with a face cloth. And you can improvise either wearing a bandana or making your own face mask. And everyone should not only continue to stay home when you do not need to go out to help reduce the spread of COVID-19, but if you must leave for essential needs, please keep adequate social distancing of at least 6 feet away from others, and please wear a mask or facial covering. Many people who are infected with COVID-19 have mild or no symptoms, but they can still spread the disease to others. So these measures are essential to slow the spread of the virus. There are no, sadly, any medicines or vaccines that can prevent people from getting COVID-19. And so the best way to stop the rapid spread of this disease, which can overwhelm our healthcare system and put lives at risk, is to please stay home unless it's absolutely essential. When you are outside, to please stand at least 6 feet away from the other person, and please wear a facial covering. It's essential that you follow this guidance, not only protect yourself and your family, but the broader community. So in closing, please do your part to protect our community during this difficult time. Practice physical distancing, wear face coverings, wash your hands for at least 20 seconds, and stay home to save lives. We know that scientists and top officials are telling us that these next few days and weeks are the most critical time where we're going to see a surge in cases. So we need to stay home unless absolutely essential to maintain the capacity of our hospitals, to help flatten the curve. I'm really proud that in the Bay Area, because we were the first to issue a stay-at-home order, that we are already seeing effect from what we've been doing staying at home. We are helping flatten the curve. So the more that you can follow these guidelines, the more you can not only protect yourself, your family, but the broader community. So please do your part for the sake of your health, for the health of your family, for your neighbors, and for your community. So thank you for joining us. Please visit my website, jesseedegin.com, for a resource guide about COVID-19. Please join us on Wednesday for the next briefing, and please stay tuned for information about our upcoming town hall. Thank you, Berkeley, and please be safe.